Hello everyone, it's Mike Lister from the City of Anaheim, and it is Monday, April 13th, and we hope everybody had a great Easter, and to our Jewish friends, we hope you are having a joyous Passover. We want to provide you a brief update on where we are with coronavirus. We've been getting a lot of questions and even comments about cases, so we wanted to begin with that. So here in the City of Anaheim, as of April 12th, now remember this will change, and for the most accurate daily counts, make sure you are going to anaheim.net/coronavirus. Now, but as of April 12th, which was Sunday, we have 146 cases here in Anaheim. We have been seeing a steady increase as we are at what many health experts believe are the peak of the outbreak. We are tracking the countywide trend, and while we certainly don't want to see any cases here in Anaheim, the cases we are seeing are tracking our projections for our city. Now, here is a bar chart showing Anaheim's cases going back to March 29th, and as you can see, it is that steady increase. So as more testing is done in Orange County, we are going to see more cases, and again, we are at the peak. That could be this week, it could play out for the next few weeks, but we are going to see more cases. So as we know that cases are going to rise, what we are looking at is a baseline. We are at 11% of the county's cases, and that happens to be exactly Anaheim's share of Orange County's population. So we are tracking with what you would expect us to be at this particular time. Now, there's a couple other ways to look at it as well. Every city is tracking with their share of the population. So Anaheim is the largest city in the county with roughly 360,000 residents, and we have the most cases, and we also have the most population. And then if you keep going down, ranking cities by population, you'll see that their case numbers fall in line as well. Santa Ana is second with 111 cases, and of course second in population behind Anaheim. Irvine is third with 97 cases, and third in the county in population, and Huntington Beach is fourth with 87 cases and fourth in the county in population. So this is all to tell you that, again, while we do not want to see any cases here, we are not necessarily alarmed by the number of cases we are seeing, because that is tracking with our city's share and with those of other large cities here in Anaheim. Now, one other way to look at it is on what's called a per capita basis, and in this case, it is number of cases per 10,000 residents in a given city. This is a way to equalize and kind of put every city on a normal footing to figure out how many cases do they have on that representative sample. Now, you'll see here that we are actually within the middle. Per 10,000 residents, we have 4.1 cases. Now, other cities, and this is for comparison only, I want to stress, no city is immune, and we have to be respectful of other cities. We're all dealing with this, but for point of comparison and point of information, you'll see that smaller cities like Laguna Beach and Newport Beach actually have higher per 10,000 ratings than we do. Now, we're not quite sure why. It may be access to health care, it may be older populations in those cities. Villa Park is the same, a little bit above us on that per capita basis. And then you go to the low end where you've got Stanton with 1.3 per 10,000, Brea just above that, and Fountain Valley just above that. So that's to give you a little bit of comparison. While you will hear that Anaheim does indeed have the most number of cases here in our county, there's different ways to look at it, in which ours is certainly proportional, and we're actually middle of the pack when we look at it on a relative basis. Now, switching to county-wide, another thing we are watching is what's called the positive rate of testing. That is, how many confirmed cases do we have to the number of tests that are being done? And in Orange County, that is 9%. Now, the reverse of that means that 91% of tests are coming back negative. That can be a good sign that we are managing here. Now, of course, it can be skewed if you do too few tests, and it can also be skewed higher if you only test the most obvious patients. That is, folks already showing symptoms. But with Orange County currently pressing about 14,000 total cases, we now are getting to a place where it's a big enough representative sample. Of course, there can always be more tests that are being done, but the number that we are seeing now is giving us a good indicator that we're seeing a fairly good example of what would be a positive rate that many are looking to see if we are managing. Now, it could go up. We have to be very careful about that. But for right now, it's tracking very well compared to California at an 11% positive rate, Los Angeles at a 14% rate, the United States at 19%, and of course, our hearts go out to very hard-hit New York, which is 40% of tests coming back positive. Now, where we are at with testing, again, we are nearing 14,000 tests being done in Orange County. It remains on medical priority. What that means is someone who is having symptoms, someone who has exposure risk, somebody who's cared for a COVID-19 patient, a first responder, a healthcare worker, a relative. Those folks are always going to be first. And we know there's a lot of debate about testing out there, and certainly we could do more testing. There are certainly cases with folks with symptoms who will not be tested. They will be told to isolate at home, and we understand there's a lot of frustration out there about that. But we are seeing testing here grow by the day. And then just a note on testing, there really are two types. There's confirmation testing. What you'll often see is that nasal swab. That will tell you whether or not somebody at that given moment has test positive for COVID-19. The second test out there is an antibody test, which might have more usefulness going forward to determine whether me, you, or anyone has been exposed to it already, has the antibodies in our body to fight it off, and that gives some idea about whether or not that person, about a developing immunity. We're still not sure whether or not folks will have immunity, but that's certainly something we are looking at. The limitation of the confirmation test is it tells that person right now whether you have it or whether you don't, and it gives you peace of mind for a very limited window. The next day, you could face the same risk of exposure going forward. So that's why you will see some limitations on confirmation testing. Now, where are we with the different orders? We've gotten a lot of questions about this. We hear a lot about April 30th, May 15th, etc. So here we wanted to kind of clarify some of this. So Anaheim, the County of Orange, and the State of California, we are all under health orders that are until further notice. Those all started on March 19th. And what does that mean? Until further notice does not mean forever. The intention is to provide some flexibility week by week so the order can be lifted when the time is right. Now, why you've been hearing a lot about May 15th is because on Friday, the county and city of Los Angeles, which originally came out with their stay-at-home orders, often referred to as safer at home, they originally came out on March 19th, following California's order, and they had originally set a tentative end date of April 19th, but of course, California's order remains in effect. No one is suggesting lifting those orders anywhere in California at this time, so now they have extended theirs to May 15th. It's always possible that gets extended again. Two ways of thinking about this. One, provide a date to give somebody something to look forward to, or continue to go until further notice, which gives that week-by-week flexibility. But again, we in Anaheim, because we share the same media market with Los Angeles, every day we will hear their press conferences, their mayor talking about things, and they are doing a fantastic job, and there's a lot of relevance for us here, but when it comes to the stay-at-home order, Anaheim continues to follow California's order, which is until further notice for that week-to-week flexibility. Now, the federal government has what is called 30 days to stop the spread. These are guidelines, a little bit different than the health orders that we have from the state of California or even that we're seeing in Los Angeles County. Guidelines are strong recommendations, but they do not carry the same magnitude of force that a health order does. So the federal government's guidelines go through April 30th, with always the possibility of being extended. So hopefully that provides a little bit of clarity about the different dates that you may be hearing about and seeing out there. Now, masks. We get a lot of questions about masks. So here in Anaheim and in Orange County, we strongly recommend that people wear masks. I have a surgical mask right here that I am socially distanced from everyone now, so I'm going ahead and just wearing it to the side so folks can better hear me. But in common areas and when interacting with other people, when I go out in public as an essential worker, I wear this mask. Now, many people are asking, why aren't you mandating it? Well, it's quite possible that the state of California may very well end up mandating the use of masks, and we as a city would certainly welcome that. But the real reason why is that mandates can be helpful, but social adoption is best. So we encourage you to wear the mask. The more we see others out there wearing masks, the more other people will do it. This is really a social issue at heart, and we need people to embrace wearing masks on their own. Mandates can help, but again, us all doing it, doing our part, will be most effective. So where are we at? So we are at what is the projected peak. We could be in that now and for the next few weeks. We're going to have some tough weeks ahead. That means more cases here in Anaheim, Orange County, California, the nation. What is our hope? Our hope is to see a tapering in May and a gradual recovery in June. Now, this is our hope, and what that would mean is a gradual recovery. We're not just going to hit a button or a switch and life will return to the before times. It will be gradual. You will see some facilities reopen, but we may still be required to wear masks. We're certainly going to be following best practices, washing our hands, hand sanitizing, keeping social distancing. It will be a gradual recovery, but we would hope, if we are fortunate, to start that in June, but conditions will dictate that. We will see a continued mix of big gains in cases one day, milder cases the other. And we want to take a minute and note, we know everybody has stay-at-home fatigue, anxiety, frustration. We're hearing it. You're only human. We share it. We all know it. And part of just getting through it is acknowledging that. So we want to thank everyone for what they're doing. We're seeing some encouraging signs out there. Keep doing what you're doing, but we know there is frustration and anxiety that comes with this. Now, in terms of our hospitals, Orange County is in a fairly good position. We have 25 emergency hospitals, and they are all fully operational. We have 4 here in Anaheim with emergency rooms. They are fully operational. 17 of Orange County's emergency room hospitals have surge tents at the ready. The photo here is of Anaheim Regional Medical Center and the emergency room staff, some incredible people, and their surge tents right here off Euclid and La Palma. Now, thankfully, Orange County hospitals are at 50% capacity. You have heard very heartbreaking stories about New York and maybe parts of California or even in Washington State about hospitals that are stretched. 50% capacity plus surge tent capacity means we are not stretched at this time. We have room to treat patients. The hospitalization rate for COVID-19 patients is about 8%. That is relatively low. So we have some headroom, as we say here. And about half of all COVID-19 hospitalized patients are in ICU. Our Emergency Operations Center here at the City of Anaheim, our emergency medical division, calls nursing homes, hospitals, and other healthcare providers every day to talk to them what about their needs. Personal protective equipment, masks, gowns, and we work with them. And while there always can be some sort of needs, we are doing very well, and nobody right now is hurting for that critical equipment. We will continue to monitor that. Now, this might be a little bit hard to see, so we'll zoom in a little bit, but this is hospitalization in the County of Orange. The main thing you want to look at is on the right-hand side, which is a trend of lower hospitalization, starting somewhere around April 8th and then going to April 11th, which was the most updated information here. And you can see that sort of downward slope in number of folks who are hospitalized, and then also some downward movement in the number in ICU. This will continue to fluctuate as it does, as in this chart, but we do look for running trends, and we certainly can take some encouragement from what we are seeing now. And then moving on, here at the City of Anaheim, we are continuing to do what we are doing. Our Emergency Operations Center is up and running every day. We are talking to healthcare providers. We are coordinating donations. We are reaching out to seniors and other needy members of our community. Police, fire, utilities, public works, they are all still out there working on your behalf every day. Our planning counter continues to work on a priority basis. Necessary projects we want to keep moving, and then also projects looking to recovery. We know so many people that we've seen their jobs impacted, and we know we need to look forward to that day when we can resume projects. So that is what our planning department is doing. And of course, we continue to provide daily information at anaheim.net/coronavirus and on City of Anaheim social media, Facebook and Twitter, as well as Instagram. So with that, that is our update for today, which is Monday, April 13th. We want to thank everyone for hanging in there, and take care. We are in this together, and we will get through this together. Thank you.